And what we're going to start off first with is the purpose behind the progesterone. So usually with progesterone, what they're doing is trying to implement or optimize the luteal phase. So when you're gearing up for frozen embryo transfer, fresh transfer, depending on your medication protocol, we want you to have the supplement of progesterone, which helps to keep the uterus nice and sticky and helps with the development of the placenta. What we're going to do is get Vicky to stand up, and we're going to do some landmarking. When you're doing landmarking, there's two sites, and I find that if you have a partner or a friend who's helping you do the injections, what you're going to do is go where you have her butt or her buttocks, and you're just going to score it in half, so just down the middle, and then you're either going to go to the right or to the left because you want to rotate your sites. If you're going to the right, and we'll decide which side we're doing, you're going to half that one more time and then half. So you're going in the upper outer quadrant for this injection here because it is an intramuscular injection, so just in this area here. And it's a rather large muscle, so you don't have to continuously keep going into the same site. It is normal. You see a little bit of bruising here where she's done her previous injections, and that's very, very normal. The other thing that's important is that if you're having bruising prior to your injections, you can always use a cool compress or an ice pack just to kind of numb the area first prior to doing the injection. But this is the area you want to be going into. So halving the buttock and then the upper outer quadrant here. Now, the other landmarking that I really prefer, so this would be ideal if somebody is doing your shot for you, but what I like is the ventral gluteal, which is if I take the palm of my hand and I find her hip bone here, there's two large muscles that overlap. So this is your ventral gluteal in here, and then your upper outer quadrant. So it actually extends the area for you to be able to do this shot. So when you're doing the shot, and if you've got your palm and you're just like this, so it opens it up really wide, giving you an extra area. And I always find that patients, when I'm doing this shot, patients say that this is preferable because for some reason, after you've done so many shots back here, you tend to have like soreness and you can't sit properly, whereas when you move it to the ventral gluteal, it tends to be a little bit easier where you can actually sleep on your back. You're not so sore when you're sitting or walking. Now, the other important thing is that when you're doing the injection, you want to make sure that you're not having any sharp pain down your leg, and we'll go through that. So we're going to do ventral gluteal. So we're going to go here, but we'll decide what side is preferred for today. Okay. Now, what we're going to do is draw up the progesterone in oil. So the progesterone in oil is a multi-dose vial. Sorry.
That's okay.
And every time you're going into it, because originally when you get it, it will have a seal on it. So you want to either pop the seal off, and it's either like this or it'll be a foil seal that you can pull off. And you want to take an alcohol swab and just clean the top every time you're going in. You want to let it dry a little bit. You take your syringe with your large needle on it. Now, this one here has a 22 gauge needle. It's 1.5 inches long. This is what we're going to use for the actual injection. To take out the oil though, we're just going to unscrew this needle here. We're just going to place that down. We're going to take the 18 gauge needle, and this is a really big needle, so you don't ever want to inject with this. You're going to also just screw that on. So that's the difference in that size. So don't ever inject with this needle here. You're going to go in through the rubber stopper, turn it upside down, and then you're going to pull back to your dose. So if you're doing 1 cc, which is equivalent to 50 milligrams per mil, it's just down to the 1 like that. So you just want it to look like that. Pull this off. You're going to put that back wherever you're storing it at room temperature. Don't put it in the fridge. You're going to remove this large needle. So you just want to pull back a little bit because there is some of the medication that sits in the tip of the syringe to the tip of the needle, which is just the dead space. So we're just going to gently recap, unscrew this needle here, and then we're going to put this 22 gauge 1.5 inch needle on so it's a little bit nicer. Screw this on. You want to hear that squeak to know it's on securely. There is a little bit of air in there, so we're just going to gently push up on the plunger until you see a bubble at the tip of the needle, and that's when you're going to know that you're ready for the shot. So just like that, okay? So you've got the 1 cc right there, and now we're ready to do the injection. Okay?
Perfect.
All right. I'm gonna.
Yep.
Okay.
Can you see what you need?
So you want to clean the area with the alcohol swab. So I'm just going to do this here. And you'll probably be able to see under this lighting that she does have some superficial veins that we can see. So you want to avoid going directly through that. So what we're going to do is just go in, and I'm going to avoid these larger veins. Just take some nice deep breaths for me. And we're going to pull back just to make sure that there's no blood vessel in there. And then we're going to go in and inject all in. And then we're just going to remove the needle, press to minimize any bruising or bleeding. The other thing that's recommended as well, you want to massage the area for 2 to 3 minutes, I usually say. If you're doing your shots and it feels really tender or sore, you can use a warm compress throughout the day several times. Some people will just do it right after the injection, and it just helps to avoid any lumps, which are very, very normal when you're doing these progesterone injections. I find that, so she's not really having any bleeding, which is another reason why I like doing the shots there, because I just find that there's minimal bleeding, bruising, as long as you're avoiding any of the superficial veins, but everything looks good. All right, so when you're disposing of your needles, you want to make sure that you're putting them into medical waste. Do not throw any of your supplies in the garbage. Wrappers can be thrown in the garbage. However, needles, syringes, empty vials, you want to be throwing into your medical waste. If you don't have proper medical waste container, a lot of clinics will recommend using a Tupperware or a jar of some sort until you go back to the clinic, and then they'll dispose of your medications for you.